Hello, and welcome to today's webinar on nursing dental clinics. Essentially, you'll be learning how to run your own nursing dental clinics, what to look for, what advice to give, and how best to facilitate these clinics and have these clients well educated and returning to you. So, what is dental or periodontal disease? Dental disease in animals refers to any abnormal condition affecting the teeth and jaws of animals. Interestingly, dogs do not get cavities the way humans do. Cavities, known as dental caries, are caused by two specific types of bacteria which dogs and cats do not have. They do, however, develop very severe dental disease, including rotten teeth and gums. It can range from simple problems like tartar buildup and gum inflammation to more serious issues like tooth decay, tooth loss, abscesses, and oral tumours. Common causes of dental disease in animals include improper dental hygiene, genetics, injury, and dietary imbalances, all of which you need to be able to address in your dental clinics. So, how prevalent is our periodontal disease? It is estimated that over 2/3 of dogs over the age of 3 have periodontal disease. And periodontal disease starts as gingivitis, caused by plaque, and often progresses to involve the bony tooth sockets. Left untreated, periodontal disease can lead to painful tooth loss. It's important to know the anatomy of the teeth as well when explaining to owners how disease comes about within the tooth itself. So, animal teeth, like human teeth, are made of a crown, the part you can see, and then the root. The root is under the gingival gum, gingiva or gum, and is the part that both anchors the tooth in place and connects it to the bod's blood supply. Deep inside of the tooth, from the root to the crown, is what is known as the pulp. And this is very important because this is the living part of the tooth and the part that becomes very painful when teeth are rotten. Some rotten teeth have enamel covered in a thick plaque or tartar, and this is usually worse on the teeth at the back of the mouth. So this is going to be your premolars and molars. Sometimes the crown of the tooth can look normal, but there is still severe infection underneath the gums. This makes the gums look red or bleeding, and they bleed easily and is known as gum disease or gingivitis. So what are your signs of having a periodontal issue? So these signs may indicate any number of dental problems, including abscesses, broken or chipped teeth, fractured roots. You could have a foreign object that's stuck in the mouth, or just excess plaque or buildup. Professional dental cleaning and periodontal therapy often comes too late to prevent extensive severe disease or being able to actually save those teeth. So common signs that we see are things like dribbling, halitosis or bad breath, having soreness in the mouth or rubbing their mouth on the floor or pouring out their mouth is quite common. Difficulty in eating as well, and sometimes we can see the bleeding gums. What are the causes of dental disease? So number one is usually improper dental hygiene. Lack of regular teeth brushing and dental cleanings can lead to plaque buildup and tartar, which can cause gum disease and tooth decay. Genetics. Some animals are predisposed to dental problems just due to their genetics. Injury. So trauma to the mouth can cause tooth damage or loss and may lead to further dental problems. Diet can play a role. A diet high in sugar and carbohydrates can lead to plaque buildup and contribute to dental disease. And of course, aging. As animals age, they are more susceptible to dental problems, including gum disease and tooth loss. There is also systemic health conditions. So certain health conditions, such as diabetes or kidney disease, can increase the risk of dental disease in some of these animals. The dangers of dental disease are often one of the main things that you need to speak to owners about in order to encourage them to take more care with their animals' teeth. So rotten and decaying teeth are painful and dangerous for animals, and left untreated can lead to other diseases. Dental disease can put dogs at risk for the development of heart and kidney disease, cause elevated liver enzymes, which may impact how medications are tolerated. Rotten teeth can also weaken the jawbone around them, leading to future dental loss, increasing the risk of jaw fractures. Most importantly, excessive bacteria left in the mouth can enter the bloodstream and can lead to a bacteremia and fatal septicemia. It's important not to underestimate the severity of pain and discomfort that rotten teeth can cause. So when we talk about breed genetics and dental disease predispositions, the genetics or conformation, shape and face of the mouth also contribute to the risk of rotten teeth in dogs. In some breeds, such as Dachshunds and Yorkies, even daily brushing may not be enough to prevent dental disease because these breeds are overrepresented for having dental issues. Similarly, brachycephalic dogs like French Bulldogs, Pugs, and Shih Tzus, or those with under or over bites, which are termed a malocclusion, are at a higher risk of developing the dental disease. This is because these dogs often have really crowded mouths and are more likely to develop modern teeth. So as you can see here with this brachycephalic breed, the teeth are crowded in there. So they still have the same number of teeth as a dog who has a normal jaw structure, but they're now crammed into a shorter area because these dogs are brachycephalic, so they have a flattened face. And this causes overcrowding, which means that bacteria are much able to easily penetrate into these areas and be covered from brushing or abrasive dental diets or chews that could remove them from the surface of the teeth. So being crowded can really, really help exacerbate dental disease by the overgrowth of bacteria and the buildup of plaque and tartar. So it's important to know some of the definitions that you would constantly see or use when discussing your dental clinics. So what is plaque? Okay, so plaque in animals is a sticky film composed of food particles, saliva, and bacteria that stick to the teeth. It is a major cause of dental disease in animals, as the bacteria in plaque can produce toxins that irritate and inflame the gums, leading to gum disease and tooth decay. If not removed through regular brushing and cleaning, plaque can harden into tartar, which can cause inflammation of the gums, known as gingivitis, and lead to more serious dental problems such as tooth decay and gum disease. Regular brushing and dental cleanings can help remove plaque and prevent the buildup of plaque and tartar in animals, reducing the risk of this dental disease. Tartar is a little bit different. So tartar is known as calculus in humans often, and it is a hard deposit of plaque and bacteria that forms on the teeth. Tartar can come from above and below the gum line and can cause gum disease and other serious dental problems if not removed through dental cleaning. The exact composition of tartar can vary depending on the type of bacteria present in the mouth, the diet of the animal, and other factors. However, it typically contains calcium and other mineral deposits, as well as a mixture of bacteria and other organic material. Tartar is often visible as a yellow or brown buildup on the teeth and can only be removed by a dental procedure under anaesthetic. It's really important that you drive home to these owners that once tartar is present, only a dental scaling can remove tartar under a general anaesthetic. We don't recommend to do this while the animal is conscious or to do hand scaling. What is gingivitis? So gingivitis is resulting from inflammation of the gum, also known as the gingival tissue. It is caused by the buildup of plaque and tartar on the teeth, which leads to irritation and swelling of the gums. The gums may become red, swollen, and bleed easily, especially during brushing or chewing. If left untreated, gingivitis can progress to more serious forms of gum disease known as periodontitis and lead to tooth loss and other oral health problems. Gingivitis is often the first stage of gum disease and can be prevented and treated through regular dental checkups, cleanings, and good oral hygiene practices such as daily brushing. It can also be caused by other factors such as hormonal imbalances, certain medications, and certain systemic health conditions. So, when we talk about periodontitis is a more advanced form of gum disease that affects the tissues and bones supporting the teeth. It occurs when gingivitis or inflammation is not treated and is allowed to progress further. In periodontitis, plaque and tartar spread below the gum line and create pockets between the gum and the teeth, leading to infection and destruction of the supporting tissue and bone. And as the disease progresses, the gums can continue to recede, which you can see here, ex- causing exposure of the roots of the teeth, and that's when the teeth can become loose or even fall out. And it is a serious oral health problem and can have a significant impact on the overall health of the animal, not to mention how painful it can be. And in this picture, you can see that there's plaque, then you've got your gingivitis and your inflammation there. And then as the periodontitis increases in severity, you get bone destruction, which you can see this here. So there's a bone has broken down here, and then you see what we call a pocket. So you get a little bit of that gum or gingiva receding away from the tooth, and then it advances more to severe bone loss with deeper pockets, which you can see over here, and that's when the tooth is in danger of falling out. So how do you know when you've got different stages of dental disease? So this is called dental grading. And there are usually 4 stages of dental grading, or 0 to 4. And stage 1, which you can see here in this diagram, what you have here is some inflammation. So a margin of attached gingival gum is inflamed and swollen. There is a little bit of plaque covering the teeth. But at this stage, the treatment can reverse this condition. So you can actually do a clean or do some brushing of the teeth, and that should resolve that inflammation and can remove some of that surface plaque, which is what you can see here. When you are at stage 2, which is your early periodontitis, entire attached gum is inflamed and swollen. So you can see a lot more inflammation right here. The mouth is painful, and you may start to have an odor coming from the mouth as well. Professional treatment, usually in the form of dental scaling, can prevent this from becoming irreversible. So usually you do need some form of intervention here to get in here and try and scale some of this horrible calculus and plaque away and calm down that gingivitis. When you get to stage 3, this is quite advanced. So it's a moderate periodontitis. And this cherry red and bleeding gums, you can see here. And it's being destroyed probably by an infection, which looks like it's going on here. And of course, the calculus and tartar, which is full of bacteria. And this is when their mouths are really sore, and it can affect their eating and behavior. They have halitosis. And this is really the beginning of your severe periodontal disease, where this may be irreversible and you more likely will have some form of tooth loss. And then, of course, this is an advanced stage of periodontitis, and you will have a chronic bacterial infection destroying the gum. So there's a lot of recession, which we can see here. We're almost able to visibly see the roots. And then there's also going to be bone destruction and, of course, destruction to that tooth itself. Bacteria at this point could be spreading through the entire body via the bloodstream and may damage the liver, kidneys, and the heart as well. So that's what you can see here, and this will most likely result in an extraction or a tooth loss if left on its own. This is another diagram just showing the stages again. So another way we can see when we have our early gingivitis and we have some inflammation, very mild. Then we move on to that recession that we can see here as well. And then we get our bone destruction and increase in the amount of bacteria, greater gum recession, exposed roots, and then this is when you have deep pockets of infection and severe boneless, and you will have mobile or loose teeth. So then there is also something to note called resorptive lesions, or called phorals in feline or corals in canines, and they occur when cells called odontoclasts dissolve the tooth structure, resulting in the destruction of the tooth. And this can cause pain, inflammation, and infection in the affected tooth and surrounding tissues. Now, the cause of resorptive lesions is not fully understood, but it is believed to be related to factors such as genetics, immune system dysfunction, and diet. So, resorptive lesions can affect any tooth in the mouth, but they are most commonly found in the premolars and molars. And the diagnosis of a resorptive lesion is typically made through dental examination, including dental x-rays, because a lot of the time, your resorptive lesions can be below the gum line, which of course you can't see from the surface, but can be exposed via your dental x-rays. And these images here show the different types of resorptive lesions that you can actually have, or how they're actually classified in at least 5 different stages. And there's differences with, you have resorption of sometimes of the roots, which you can kind of see going on here. And then you can have resorptive lesions at the crown. And also you can have a crown that's pretty much intact, but still have a resorptive lesion below the gum line as well. Also, tooth fractures, so you need to be looking for these. So this is when you have to decide on repair or extraction. Depending on the severity of the fracture, the tooth may need to be repaired or extracted. If the fracture is minor, the tooth may be able to be repaired with bonding or filling materials. And more severe fractures may require extraction, especially if the tooth is causing pain or infection. Now, dental x-ray is the best way to know if the pulp cavity is exposed, in which case extraction or root canal is often indicated. And again, these are some images showing the different types of fruit fractures that you can have, whether it's at the root itself or you can have a fracture at the top or the crown of the tooth. But dental x-ray will show you that, and most importantly, will sometimes show you if there is actual pulp exposure and the animal is at risk of catching a serious infection. You should know how many teeth are in the cat's and dog's mouth to know if any are missing. Maybe there's teeth below the gum line that are resorbing. Maybe there are just snapped off crowns and just retained roots. They could have had a dental prior. So knowing your dental formula is very important. So adult dogs should have 42 permanent teeth as compared to humans who have 32 teeth if they were to keep their wisdom teeth. The upper jaw has 20 teeth while the lower jaw has 22 teeth. And these comprise, similar to humans, molars, premolars, canines, and incisors. Cats have fewer teeth. They have 30 permanent teeth, which is, of course, less than our dogs and humans, rather. And they also do have the same, they do have a variety of incisors, canines, premolars, and they have 1 molar on each side and on each arcade. Now, baby teeth or deciduous teeth are also quite important. Just like in people, animals do have deciduous teeth. These teeth may stay in the mouth until 4 to 6 months of age, when the adult teeth should erupt, pushing the deciduous teeth out. This process does not proceed correctly in some pets, which results in the deciduous tooth being retained in the mouth. Retained deciduous teeth cause problems by causing plaque accumulation and impeding the eruption of the adult tooth. So deciduous teeth need to be extracted promptly if they are left retained. And this is something that you can easily see on inspection in your dental clinics, because as this picture shows, you've got your adult tooth here, and then you've got this slightly smaller curved baby tooth or deciduous tooth in there. And this is your eruption timetable for these baby teeth, and when you expect them to be in the mouth as a kitten or a puppy, and when they should be having their adult teeth coming through. If they far exceed these ages, then that should be an indication to you that maybe there needs to be a dental intervention. So now you have the basis of all your knowledge of what you need to be educating the owners on regarding dental teeth formulas and the actual etiology of dental disease, you need to now start the clinic. So you would introduce yourself and position in the practice and how you're due to support optimal dental care. So you would discuss that you will often do dentals maybe with the vets, and you will stage or chart the dental disease, talk about scaling and polishing, but you monitor anesthesia when these animals are having dentals. You're also qualified to give home dental care and nutritional advice. You should always do an overall health check, even if you're just there for a dental clinic. So it's important to get the animal's history, their age, nutrient status, breed, species. You might want to discuss diet because that may be affecting their dental disease. An optional check, or what I call an opportunity check, would be to check the vaccination status, whether they're microchipped, are they ticked or dewormed recently as well. And also, an advantageous thing to do is look at their weight and body condition, so discuss if needed. If you can, also take their heart and heart rate, record that. Have a quick once over of their skin and ears to highlight any other problems. You may want to palpate their lymph nodes or look for any lumps and bumps. And also you might want to check their nails as well. So these are just an overall health check, that what I call an opportunity check, while you've got the animal there. Now, when you come to doing the dental check, you have to mandatorily check the teeth and gums on both sides and use your charts if you need them. Don't forget to open the mouth and check the tongue, hard palate and back of the throat if able to. Not all cats especially are very compliant in allowing that to happen. And when you do check the mouth, always involve the owner in this check. So highlight to the owner where you can see this gingivitis or plaque or tartar, and also include them in the dental grading if necessary. Say, I can see this is a stage 2 because I can see more gingivitis and there is some gum recession, etc., etc. Try to revert to pictures. There are dental molds or literature that you can have ready in the clinic, and this can help you to really reflect that grading system as well. What you want to also have is your checklist. So when you're actually doing the dental check, things that you can tick off or mark down. So this is a simple form that you can take in that can be laminated. And what you can do is you can tick off as you go that overall, the teeth appear normal. There's gingivitis present. Are they pale or jaundice? This may highlight another ongoing issue. Is there any ulceration? Do they have their adult teeth present? Is the grade less than 1? In which case you can give home care advice. Or if it's more than 2, then you probably need to refer them for a dental scale and polish, which is something that you will come to discuss later on. And then you can actually write their actual grade or staging. Do they have a malocclusion? So underbite, overbite, maybe their teeth are extremely crowded. Are there any deciduous teeth present that may need to be removed? Are there missing teeth that may need to be investigated via dental x-ray just to be sure that they're not causing other problems, especially if you see inflammation on the gum line, but you can't actually see a tooth? Then what are your recommendations going to be? Based on that checklist and your observations, you may say that they need a dental. They may need to start teeth brushing. There may be no action necessary if their teeth are amazing and they're doing a good job already. They may want to start a dental diet, or you may have other recommendations as well. And then always leave a space to add additional notes or other findings that may be necessary when reviewing this case at another time, or if you need to speak to one of the doctors. So now you can move on to what advice you're going to give based on what you've done in your dental check and your observations. So toothbrushing is one of the things that owners are aware of. So every day is the gold standard, of course. And a small amount of brushing every day will prevent the buildup of plaque and tartar and the formation of tartar, as well as increasing the bond between the pet and owner. However, it's not very realistic for many owners to be able to toothbrush every day. Any brushing is better than no brushing at all, and brushing thoroughly 2 to 3 times a week should be enough to see a difference in overall oral health. However, brushing 3 times a week is the minimum recommendation to remove plaque and prevent tartar accumulation. It's really important to drive home to owners that they should never use human toothpaste. There are foaming agents in human toothpaste which are toxic and can cause severe sickness in cats and dogs. So there are veterinary formulated toothpaste that owners should be using for this purpose. And also make sure you show owners in the clinic how they can brush the teeth, because a lot of the time this can be very difficult for them to do. It's important that the owners make the experience positive by praising the dog or cat throughout the whole procedure with reassurance through every step. And this is a step line or step or guide they can go through in order to get the best results with toothbrushing. Number one, they should try and find a quiet time and place to begin. If their dog is small enough, hold them securely in their lap with the head facing away. And if they are larger, you should sit on a chair and have them sit beside you so that you can comfortably handle their mouth. Start by rubbing your finger or a soft cloth over the outer surfaces of the dog or cat's teeth, using a back and forth motion, focusing on the area where the gum touches the tooth surface. Be careful to stay on the outside areas of the teeth to avoid being accidentally bitten in the beginning stages. For the first few lessons, it's a good idea to rub the cloth only along a few teeth rather than the whole mouth, especially if they're unsure or nervous about the process. Once they become a little bit more comfortable with you rubbing the teeth, let them taste a little bit of the toothpaste from the finger. Most of the time, the toothpaste for the cats and dogs are flavoured, so they are quite palatable. And once they have accepted the taste of the toothpaste, apply a small amount to the same cloth and rub it over the teeth. Once they are completely used to rubbing the cloth over the teeth, then you can slowly advance to using a toothbrush. So this is the best way to introduce toothbrushing. That's not going to be too much of a big shock to the animal coming at them with a big toothbrush. Start with a cloth. Also, you need to try and start early. So puppies and kittens are more likely to accept training if you start it from a very young age, even if they don't have any signs of gingivitis or plaque or any tartar buildup. You should be still brushing clean teeth. Go slowly is very important. Be patient and always make it positive. There's a variety of toothbrushes out there, and the type of toothbrush that you advise them to use will depend a little bit on the size of the dog or cat and a little bit on their own dexterity. So many pet owners find it easier to use a finger brush, especially when just beginning to brush their pet's teeth. There are brush with angled handles or brush with multiple heads that you can simultaneously brush the inside, outside and top surfaces of the teeth. These are particularly useful because it means that the brushing session can be done quite quickly. There may be small brushes that fit comfortably in the hand and finger toothbrushes designed to fit over the tip of the finger as well. And as we said, how to brush the teeth: apply a small amount of toothpaste to the brush, gently raise the lip on one side of the mouth when you're using the toothbrush. You can either do this by pushing up on the lip with the index finger of the free hand, as shown in this image over here, or by placing your free hand over the dog's head and then with your thumb. Brushing at a 45-degree angle will allow the toothbrush to clean the gums and teeth properly. You don't need to rinse these pet formulated toothpaste. Once you brush the pet's teeth for about 2 to 3 minutes, you could just simply let them lick the remaining toothpaste off of their teeth, and they are designed that they're safe for them to be swallowed. Light bleeding can be normal, particularly if gingivitis is present. But however, moderate to heavy bleeding may indicate a dental problem or a problem with the brushing technique. So let the owners know that if they are brushing the teeth and they're seeing excessive bleeding, that they need to come back to the clinic and seek veterinary advice. So toothpaste is important to use with the toothbrush. So toothpaste offers a more robust defense against gum disease and tooth decay, and often these pet formulated toothpaste will contain enzymes that help to break down and remove plaque and tartar on the teeth and promote a healthy mouth and prevent dental disease. They also have abrasives in them, such as silica or calcium carbonate, which help to remove surface stains and can clean the teeth while brushing them. As I said before, the toothpaste are often meat flavored or palatable, which makes it readily accepted by most pets. And don't forget, human toothpaste have high levels of fluoride, which may make your pet ill if swallowed. And some of them even have xylitol, which we know is toxic for dogs. There are alternatives as well, such as tooth gels. So while brushing is essential, dental gels are best substrate if they are unable to brush, as they are thicker than toothpaste and remain for longer in the mouth. So tooth gels often contain enzymes and calcium binding agents that fight bad bacteria and break down your plaque, which prevents the plaque formation from further increasing to form tartar. Simply apply the gel to the teeth. Once the gel touches the pet's saliva and tongue, it is spread around by the pet with their teeth and mouth, which is essential. The gel is very effective in gingivitis inflammation associated with that bacteria buildup. And once you've applied these gels, they need to withhold food and water for about 30 minutes to an hour after application. And it's really designed for pets who don't like having their teeth cleaned. You just simply apply the gel to the teeth and let them lick it around their mouth to let it start its work. You can also use mouthwashes and water additives, and these products typically contain ingredients such as enzyme, chlorhexidine, and other agents that can help to reduce plaque buildup. And when you add these products to the pet's water, they will mix with the water and be distributed throughout their mouth as they drink. The product can then help to clean the pet's mouth and gums and reduce the risk of dental problems such as gum disease and tooth decay, and also helps with the bad breath. There are also dental chews, which can help to improve their oral health by promoting tooth and gum health. The chews typically contain enzymes as well, or other active ingredients such as some types of seaweed, which contain natural compounds that can help prevent the buildup of plaque or tartar on their teeth. Dental chews also help to mechanically remove plaque and tartar from the teeth and massage the gums. Additionally, chewing on the dental chew can help to stimulate the production of saliva, which can help to neutralize harmful bacteria and promote your better oral hygiene. Bones are another safe way to stimulate the gum circulation, but it's important to purchase raw, uncooked bones, and we'll come to that shortly. Always try and recommend verified dental health aids. So some food, chews, and toys can help to slow the development of dental tartar and gingivitis. And there is the Veterinary Oral Health Council. And the items that are approved by the Veterinary Oral Health Council will have this stamp on it, and it looks exactly like this in this picture. And this is a stamp given by a group that promotes dental health through tested products. So there are a list of approved dental products and diets are found on the vohc.org website. And these accepted products have been proven to decrease the accumulation of plaque and or tartar by at least 20%. So try and find products that have this seal on there so you know that they're actually going to be very, very effective. Now, dental under general anesthetic is a very common practice in veterinary dentistry, as it allows for a thorough and comprehensive examination and cleaning of their teeth and gums. The GA will allow them to be fully sedated and pain-free during the procedure, making it easier and safer to remove the plaque and tartar. So the dental under GA is typically recommended for pets that have significant dental disease, such as periodontal disease or tooth decay, and may require more extensive dental work. And two components of this is the scaling. So this is using a mechanical scaler with a probe or oscillating tip that uses high frequency vibration water in a circular motion to break up and remove any plaque buildup and mild tartar from the teeth. The tip is positioned perpendicular to the surface of the tooth and just below the gum line. And of course, it's important to explain to owners why dental under GA is very, very, very effective being able to control or remove that plaque or tartar buildup. It is the only method when they have a greater grade of stage 2 of dental disease. And then after dental scaling is polishing. And polishing is where often after the scaling procedure, a rough surface can be left behind, which is ideal for bacteria to adhere to and to be trapped. So you use a polishing paste, which has microfibers in there, which are used to smoothen the surface of the tooth, preventing plaque buildup. So polishing isn't just to make the tooth shiny for aesthetic reasons or to give a nice smelling breath. It does do both. But the primary reason for polishing is to smoothen out a rough surface to prevent bacteria being able to adhere and cause infection. Dental scaling, unfortunately, can be uncomfortable. So this is why we say to do it under general anesthetic. It should never be recommended conscious. It's not fair to the dog or the cat, and it can be uncomfortable. So to make sure as well that you have full access to all the teeth in the back of the mouth, you do often need them to be asleep. There are diets out there which you can use as well. So as you can see, this is a diet by Royal Canin, and this has got that VOHC seal of approval on there. And as you know, bacteria naturally settles on the teeth after meals, which can cause a buildup of plaque and tartar and could eventually lead to gum disease. So these kibbles have an advanced texture that cleans the teeth while they're chewing. They surround the tooth as the dog bites down. And so every mouthful rubs the surface with a brushing effect. So it works to abrade the surface of the tooth. They are also enhanced with a binding agent that bonds to the calcium in the mouth and helps to reduce tartar forming. They have antibacterial, anti-adhesive properties, which will also help prevent plaque formation. So in this diet, you have anti-calculus nutrients. These are called polyphosphates, and they're contained within the kibble and are released when the kibbles are broken down. And they actively bind calcium, as you can see, that's what's happening here, and prevent adherence to plaque and the formation of tartar. So using these diets in this way, you can see how they can effectively reduce plaque formation. There are some dental products to avoid. Okay. So things like rawhide bones, bleached white, flavored and twisted into fun shapes are also unsafe for your dogs. Most are made of indigestible animal skin, which is bleached and glued together. Rawhide becomes soft and gummy as your dog chews, so it does not actually clean their teeth. And the rawhide itself can actually swell up to 4 times its original size in your dog's stomach, risking the formation of life-threatening blockages. They can also chew off and swallow large pieces of rawhide, such as some of those knots, which can get stuck in their esophagus, stomach or intestines, and can cause a blockage, foreign body blockage, which often needs surgical removal. Some are items that are marketed as dental products are potentially dangerous because they pose a risk of chipping, breaking or fracturing the teeth. Some of those include nylon bones, sterilized or bleached bones, and cooked butcher bones, which we should never ever give. And bleached or cooked can be more brittle and prone to splintering than unprocessed bones. When chewed, these cooked bones will form sharp pieces which can break off and become stuck in the teeth and gums, or worse, cause gut perforations in the stomach and intestines. So, next step after you've done your dental check is, of course, you have to plan and recommend. So we've gone through all the things that you can plan and recommend. So you need to discuss the implications of dental disease and stage of dental disease the pet is showing. If it's a grade 2 to 4, discuss if dental cleaning under GA plus or minus extraction is needed to tackle the problem before preventative measures can be taken. Refer to the vet for full recommendation and cost estimates. If grade 1 or 2 or post-op dental surgery when you're doing the discharge, discuss regular toothbrushing and whether it's something they feel they need or they could manage at home, and then you can show them how to do it. If brushing is impossible, then you can discuss the importance of switching to the dental diets as discussed to keep plaque and tartar under control. If necessary, discuss the other preventative measures such as the oral gels and chews as oral washes available, which we've just seen. Always present the client with a sample pack for added value to the surface. So sample packs, which we'll show a little bit later, really do help. And offer a free follow-up in 3 to 6 months. When owners are going to be brushing, they must maintain hygiene as well. So a dog's mouth or cat's mouth contains a lot of bacteria. So try and get owners to wear gloves while brushing the teeth. If no gloves, thoroughly wash their hands after with soap and water. Rinse the toothbrush thoroughly before putting it away, and they should replace the toothbrush every 3 months or so. Try and use a different toothbrush for each pet in the home. So we discussed before giving little giveaway bags or sample bags, and I like to call these your dental goodie bags. At the very minimum, every practice should have some form of pet toothpaste, standard toothbrushes, finger brushes, and dental diet on sale. And if not, this is a great opportunity to advise. So the home dental care pack should include the following: at least a dental food leaflet, so giving information. If you can give a dental sample, so you can give pre-packaged samples yourselves if they're not available commercially. So you can make them with a small grip seal bag, take a few dental kibble out from another bag to distribute, clearly labeled with the expiry date and breed size, etc., so it's not left in their homes for too long and they give it when it's expired. And giving these dental samples can help the clients to test the palatability before they have to buy a big bag. And you can give a sample of tooth gel. You can give a sample of toothpaste and or toothbrush as well to the owners. And also list all the dental care products available. So whether it's finger brushes, mouthwashes, and try to include photographs and costs. And other merchandise to consider would be dental sticks, good safe bones. Chew toys as well can really help with their dental health, especially for the dogs that will not tolerate brushing. So these are all the things that you can give in the goodie bags, and it will help bond the client and get them to come back as well. So these are just free samples. So in summary, these are our take-home messages. If dental disease is greater than stage 2, only a dental under GA is suitable. No human toothpaste ever. Toothbrushing daily or at least 2 to 3 days, every 2 to 3 days, is the most effective way to maintain oral hygiene. Never do conscious dental hand scaling. Post-dental surgery is the most optimum time to start toothbrushing or dental diets. On that discharge appointment is a very, very opportune time to discuss all of these options. You don't need to wait till a nursing dental clinic. You can discuss this straight away. Severity of periodontal disease can only really be assessed via dental x-ray and in a sedated animal. Make sure to check everywhere in the mouth, including the tongue and the cheeks, and know your dental formula so you can highlight if there's additional problems. And these are some great resources that you can get. So this is your visual periodontal disease assessment tool that you can laminate and keep in the consult room that you can show to owners to let them know what grade they're in and have an explanation for it. And then you can give examples of resorptive lesions, and this is how it looks at surface level and how it can look at x-ray level as well. And as you can see, not because it looks okay on the surface doesn't mean that there's not something happening beneath the gum line as well in the roots. And then you can show them before and afters of success of teeth when they've had a dental scaling. So as you can see, the different grades here and what it looks like before dental scaling and how good the teeth will look afterwards. So this is always great for owners to see the difference of what teeth should look like and what they can look like. Thank you for your time. I hope you found this presentation valuable. We provide in-clinic training And so feel free to contact your scientific sales advisor at vets@svcompanies.com, or you can contact me directly at k.mcnally@svcompanies.com if you would like any further information on doing these clinics, or if you would like an in-clinic training. Thank you for your time and have a good rest of your day.